Okay, so welcome back. We're delighted to introduce our next presenters. Dr. Collins, Deputy Associate Director of Health Equity in the Office on Smoking and Health, and Ms. Villaluz, Health Equity Manager for the American Indian Cancer Foundation. They'll be sharing valuable insights with us on Office on Smoking and Health engagements, current and future initiatives. Please give them our full attention as we delve into this informative presentation, and you have the floor.
Thank you. Thank you. Let me start again, like everyone else, in thanking the Tribal Advisory Committee for having us here. It's an honor to be here and present to you, and we look forward to hearing from you further, not just today, but also going forward in the future. So we really value this experience. Just want to spend a little bit of time talking to you all about some of our current and future initiatives as we roll forward, trying to achieve our vision of a world free of the harmful effects of commercial tobacco. My name again is Kevin Collins. I want to talk a little bit to set the ground, give us some context, and then I'm going to turn things over to my esteemed colleague, CoCo Villaluz, who will introduce herself in a little bit further detail than that as we move on. To set the stage, though, I think it's best that we start by giving a couple of contextual things. The first one being looking at the difference between traditional versus commercial tobacco. CDC recognizes that some American Indians use traditional tobacco for ceremonial, religious, medicinal purposes. However, commercial tobacco is manufactured by companies for recreational use in cigarettes, smokeless tobacco, pipe tobacco, cigars, hookahs, and other tobacco products. Commercial tobacco is highly addictive and contains harmful chemicals. So want to kind of set the stage there. Also, just to give a little bit of background, again, the context of things, we're addressing, we're in the process in the Office on Smoking and Health of, as we say at CDC, baking equity into everything that we do. So I think it's also important that we pause and reflect on the definition of health equity, which is, it means that all people have a fair and just opportunity to be as healthy as possible. So with that sort of as the underpinning, the foundation of where we start, I hope that's where you see where we're coming from. Our Office on Smoking and Health seeks to advance health equity by identifying and eliminating commercial tobacco product related inequities and disparities. We've developed a health equity strategic plan that is shaped by key informant interviews, did more than 2,000 inputs from people in developing that plan. We had listening sessions, conferences, and a systematic literature review and environmental scans and formal comments from the public. The plan, and I think I probably need to advance now to the next slide. The plan has 6 key priorities that address interventions. As you can see, they consist of full spectrum of tobacco products, science, partnerships, capacity and infrastructure, and the identification and increasing the identification and understanding of related to tobacco and tobacco use harms. Those are the key components of our strategic plan. And as we continue our work, we are implementing interventions that help us achieve these priority areas. While we're gonna, let me also just say, before I turn it over to my esteemed colleague, while you may hear us talk about the benefits and acknowledging certain policy interventions, we need to, for the record, state very clearly that we do not endorse, support, or promote any particular legislative action at any level. So with that, I'd like to stop and turn it over to my esteemed colleague, CoCo Villaluz.
Thank you, Kevin. Wiyoda hawashte, hafide, chazemi tawa, nisakumaki makiapi, tobeka wakwa enmati. Hinkna Hidatsa, Hinkna Chamorro, Hinkna Nakona. It is such an honor to be here with all of you in this circle and on this ancestral homelands of Muskoki. Like Kevin said, I am CoCo Villaluz, and it's such an honor. I've been working with Kevin for about 20 years now in the field of commercial tobacco control as well as traditional tobacco. And really, we're talking about this journey and honoring, right, the uniqueness that exists within Indian country. And so I just want to first state that, for many American Indians, we use tobacco traditionally, ceremonially. We also acknowledge that not everybody uses it in that way, but our hope is that people join us to honor the original intention and the gift from Creator that it is, to keep it sacred. It is a healing medicine, it's a gift, and it's held in the utmost regard. And so just always wanting to make that distinction when we're talking. And so, we encourage all of you to join us in keeping it sacred and honoring it and reclaiming it. And so that really kind of sets the stage for some of the work that we've been doing. We work on, with the tribes in many different capacities. And I work for the American Indian Cancer Foundation on all things traditional tobacco, right? We want to do things where, like Delight said yesterday, the indigenous ways of knowing. We're using our culturally based teachings and protocols and solutions to be able to create change. And also it's really important to acknowledge the American Indian Religious Freedom Act that didn't happen until 1978, which is not that long ago. I'm not going to age anybody, but I'm like, that was 2 years before I was born. So that's not that long ago, where we were not able to hold our medicine, hold our medicines, carry our medicines. Like in my bag, I have traditional tobacco. And at one point that was illegal. So we have a lot of catching up to do and reclaiming and restoring, but our tribal communities are doing that. One of the initiatives that I worked on as a consultant with the Office on Smoking and Health was conducting an environmental scan. And I went through all of the federally recognized tribes using key terms to see what kind of policies were implemented. And this was done during the height of COVID. And we found that 177 tribes have commercial tobacco policies, but at the core of a lot of those policies are, making sure that we're honoring our medicines or just honoring our cultural lifeways. With COVID-19, we've seen a surge of smoke-free casino policies because that's protecting. So, that silver lining, that bittersweet moment of seeing more of our citizens and tribal members protected by these, these policies. Also, oh, yes, we can advance the slide. If it was up to me, we would have had a lot of pictures, but we're keeping it, keeping it low key, but it was really important. And then also we conducted key informant interviews with subject matter and cultural experts from across the country to just help guide us, thinking about what best practices look like in tribal communities. And again, even the term best practices, promising practices, it came back to making sure that we're thriving and, ensuring a legacy for our 7 generations. We also have to acknowledge, right, colonization, unjust, discriminatory practices that, we're still living in those contextual times. Yesterday, when the gentleman that was sitting here, he was talking about, Ishi, who was in the museum. Just last month, my children and I, we were part of repatriation and bringing our ancestors home back to Fort Peck and reburying them because they were held in museums. And at the core of that was making sure that we were using our medicines and our cultural teachings to offer that. So when we talk about, historical trauma, those are still impacting our communities today. And how that has to deal with tobacco, knowing that we have such high rates of disease and disparities. We know that 1 in 4 American Indian, Alaska Native community members smoke commercial tobacco, but in some communities, there's upwards to 60%. So to me, that's a public health emergency. And so how do we address those? And really trying to figure out how we do this in a positive way, using the generational wisdom and knowledge. In so many of our communities, we see, cultural practitioners being held in the utmost regard and going there. And, so it's kind of like that walking in both worlds. And so that's just really important as we acknowledge, thinking about where we're always, talking about funding. Sometimes it's like the oppression Olympics where it's like, oh, I'm number one in this thing. But how do we turn that paradigm and be number one in thriving where we're healthy? We have all of these teachings. So it's just, knowing that. And I also want to state too, we're not here to shame anybody. We know good people are addicted to tobacco, and we have to understand all of those underlying issues. And so some of the great activities that are happening within the Office on Smoking on Health is that the national and state tobacco control programs, CDC provides funding to help support 50 states, the District of Columbia, 8 U.S. territories, and freely associated states, as well as 26 tribal organizations. And right now, there's a community disparities requirement that calls for recipients to partner with populations experiencing commercial tobacco-related disparities. And 8 states chose to focus on American Indian, Alaska Native populations. And those states include Alaska, Arizona, Montana, North Dakota, Oregon, South Dakota, Utah, and Wisconsin. So, as mentioned yesterday too, right? Like all of the United States is Indian country, and thinking about how we partner with all of our tribal nations, our community members, knowing that we have a large population residing in the urban areas as well. Another initiative that is happening is Rocky Mountain Tribal Leaders Council, which is based in Montana, Wyoming, is one of the 9 national Native networks funded by CDC's 5-year cooperative agreement to help achieve equity in commercial tobacco prevention and control, as well as to reduce cancer-related disparities. Rocky Mountain Tribal Leaders Council will work on addressing social determinants of health, as well as mass reach health communication on behalf of American Indian, Alaska Native communities. So I'm really excited because that's in my home state. Just seeing all of the great work that they do, it's really positive. And knowing at the core of a lot of their work too is the traditional tobacco. And I always sound like the broken record because I don't think we can acknowledge enough of our traditional tobacco, even saying it and calling it out. I think within the past 5 to 10 years, you're seeing that distinction of commercial tobacco versus traditional tobacco. So to us, that's a huge win. And even the word tobacco, that's another colonized word. In so many of our communities, we've been gathering and collecting those different translations where some is known as mountain smoke, I think in Navajo Nation. Some is like the head sacred offering. So even that, reclaiming that language in some of the work is so imperative. Another initiative that we have is the Our Breath is Sacred, a 3 Fires menthol and flavored tobacco reduction project that is housed within the Intertribal Council of Michigan. They're one of the 8 organizations funded by CDC's new 5-year cooperative agreement to reduce the burden of menthol and other flavored commercial tobacco products in communities hardest hit by the tobacco epidemic. And so what they'll be doing is focusing on building capacity to help reduce tobacco product use and initiation, as well as improve cessation among American Indian, Alaska Native citizens in Michigan. Another amazing, you guys have probably all seen, is the tips for former smokers. CDC launched the first ever federally funded national tobacco education campaign back in March of 2012. And this campaign was really to focus on, people who had real life serious impacts from smoking. And so there were ads that featured now who are 2 ancestors, Michael P., who is a Tlingit tribal member, as well as Nathan M., who's a Oglala Lakota member. And now I think fresh off the press as of last week, there's a new ad featuring Tammy W., who is a member of the Little Traverse Band of Ottawa Indians. And so these will be shared through multiple channels, media, print, radio. You'll see all of those. And, I really encourage you all to check them out and see Tammy's story. Tammy, she'll tell you herself, she was kind of that vision of perfect health. She was a marathon runner, and nobody would have ever expected that those commercial tobacco related from smoking would have impacted her in that way. So she really shares a powerful story. So I encourage you all to check out the TIPS campaign. More initiatives is that we have the American Indian Commercial Tobacco Program, the Quit Line, and that's operated through National Jewish Health. This Quit Line offers American Indians access to free, culturally tailored commercial tobacco cessation services, including calls with a dedicated Native coach. There have been some states who have worked to make sure they are creating a very specific curriculum where working with these Quit Lines for them to understand, what it is like to work with tribal communities, understanding the uniqueness between traditional tobacco tobacco and commercial tobacco, even understanding all of the little nuances, and building and creating those trusting relationships to be able to, quit using commercial tobacco. So that exists, and there's a toll-free number to call. Something that is also new and hot off the press as of December is a smoke-free native texting program. This new free evidence-based text messaging program offers a culturally aligned digital resources to help American Indian Alaska Natives, quit using commercial tobacco. And that this is something we're really proud of because we worked alongside the National Cancer Institute, Indian Health Services, University of Minnesota, and then the American Indian Cancer Foundation, where we tailored all of the different messages and tried to put more of a positive spin, talking about like generations, saying you belong here. So we're not shaming smokers, because like people who smoke or use commercial tobacco, we all know, right? It's hard. And people who want to quit and making that journey. So we're trying to put that spin on it and honoring it in a good way. So that just launched. We'll be also having a webinar on it next Tuesday and talking about that process. Another great resource is Tobacco Where You Live. It is a Native Communities Best Practice User Guide. And this brief really provides information to help develop strong relationships with Native communities, leaders and members, and communicating the harms of commercial tobacco, as well as the respect for traditional tobacco. And I just want to acknowledge all of these initiatives are done with some incredible people in this room and the tribal partners. When you work in tobacco, it's like, tobacco connects everybody, once you're in that circle, you're in it, even though you may go anywhere else. And I think that's the beautiful thing, because that is such a powerful medicine. So just acknowledging all of the people that put so much time and effort, into this work. And some of the work that we've been doing too with the American Indian Cancer Foundation is working with tribal communities to be able to do what works best around traditional tobacco. So we're seeing some of the first ever tribally led owned seed banks where they're reclaiming their traditional seeds and their medicines. And so that's really huge. We're seeing communities growing greenhouses in their medicines, sweetgrass, sage, tobacco. And so that is such a transition to help create policy change, help create educational change, and in a good way. And, thinking about where we are in 2024, it's hard to believe it's almost March and beyond. Some of the other initiatives that we're thinking about is menthol tobacco products, including how and to whom they're marketed to and sold. We know that we're at a significant risk to public health, the menthol products, because menthol makes it less harsh. We probably have all these stories. I don't know about you guys. I love Vicks. It's just that smoother taste. And so really it enhances the effects of nicotine on the brain, can make tobacco products more addictive, and can make it harder to quit smoking. So really, I think this is a time too for tribes, using what Deputy Chief Warner said, opportunity for tribes to look at how, we can do things such as prohibiting the sale of menthol and other flavored tobacco products, to save lives, especially like our communities who we know are greatly impacted, and really shifting that norm. Another really exciting thing, and maybe you guys could all come, is we're holding a National Tribal Tobacco Conference in June 27th and 28th at the University of Minnesota in Minneapolis. And this is really kind of, we know all the facts and figures, and we're encouraging all of our tribal partners to come and share what the work that they've been doing in their communities, talking about some of the work that we've highlighted here. Hearing one of the grantees that we're working with based in Utah, they are putting a greenhouse right in the center of Salt Lake in a parking lot that they share with the Mexican consulate. But like it's generated so much information. So they'll be sharing some of those highlights, but just thinking of innovative ways. We also seen tribal communities, make their own canoes or even purchase canoes to be able to harvest their medicines along the riverbank. So thinking about these kind of out of the box strategies that may seem out of the box for us, but are culturally based, to really create that change in the communities. And so those are some of the things looking forward. But, through all of this, through all of the work that we've been doing for over the past 20 years, some of the lessons that we've learned from the environmental scan, from our key informant interviews, from all of our different partners, was at the core was respecting and understanding tribal sovereignty. We've heard this time and time again that not one size fits all. And, even within our tribal communities, I have protocols and teachings of how to use our tobacco, and the next family has their own protocols. Recognizing culture and tradition are at the core of tribes. And knowing that, for us in our community, I have to go talk to the elders. When I was working on policies for our tribal nation, I literally knocked on 5,000 doors to make sure that I was getting input from our communities to see how we could create change. We even looked on how to translate Keep Tobacco Sacred in our language. And so that took time and investment. Another recommendation was to listen to Indigenous voices for solutions and strategies. Like our tribal communities know what needs to do. We got it going on. So, how do we do that? Because at the end of the day, right, we're all working towards healthy. We want to see thriving. We want to see, seventh generations. And so everything that we're doing right now is going to impact. And so, just continuing to carry that. We cannot stress enough about collaborating and partnering with tribal nations and communities from beginning to the end of the processes, ensuring that they're at that part of the table. And I'm like including in the circle, right? Making sure that there's feedback loops. In some of our work with like creating a specific American Indian quit line, we made sure to send it an email, social media, all the different ways. And now there's cool ways like TikTok, right? To get the information out to the communities to be able to provide us their thoughts and feedback on any initiatives that we were doing. Continuing to engage with tribal partners on initiatives, funding programs, and other work, especially within the Office in Smoking and Health. Another one is ensuring that representative staff or American Indian, Alaska Native liaisons positions are in place when working with tribal communities. This one I cannot stress enough. We've heard about data modernization, ensuring that data use agreements exist when conducting research with American Indian, Alaska Native communities. Another initiative that we have at the American Indian Cancer Foundation is the Tribal Tobacco Use Prevalence Project that from beginning to end, when we were working with the tribes to own their own data around traditional tobacco, commercial tobacco use, those agreements were in place. And we would only ask if we can get their number to put into the statewide aggregate, but the tribes owned all of their own information, and we would only know their specific tribal number if they chose to give it to us. So that was something that was really important and, cannot be emphasized enough as well. And as well as understanding policy terminology comes in a variety of accepted terms. Understanding policy can be seen, not always in a good light because of all of the things that have been shared. But we're trying to shift that and talking about when working in communities, policy also means writing for the way that we want to live. And we want to live in a good way. So these take on many different terms. And so that was really important for us in our environmental scan. So I think just with that we're going to turn it over to you all and part of the insight. So I think we'll go on to the next slide.
Yep, next slide, please. We saw this as an opportunity to be interactive, to hear from you as much as we wanted to present and update you with some of the things that are going on in our office. We wanted to get some feedback from you. We were presumptuous in putting a couple of questions up there that to maybe get you to think about, but if you have other questions or other ideals, we much prefer to hear whatever you have. And so with that, we'll pause and listen.
Do we have anyone from the TAC, either on the phone or at the table, who would like to have a comment or question? And I think we have 3 questions actually on the screen here. So for those of you on the phone, I don't know if you can, on your phones, I don't know if you can see it. Number 1, what information do tribal leaders need concerning menthol and flavor related policies? Number 2, what is the best way to partner with Native American, Alaska Native communities to understand the impact of the Tips from Former Smokers campaign? Number 3, are there other topics related to commercial tobacco prevention that tribal leaders would like to see OSH address? So those are the 3 questions. Yes, Sanchez.
Hi, I'm Teresa Sanchez, Morongo Band of Mission Indians. I'm just wondering, does this campaign also include vaping? The vaping tobacco pins, and how does that fit into this program if it does? Because it's a huge problem in our, especially with our youth.
So they start asking questions, you turn your microphone off?
Yeah, well, I was going.
I believe it does. I can double check that to be perfectly for sure, but we agree. Vaping is a tremendous problem across the country, and not only with youth, but with adults now. And so it is a tremendous issue So we'll definitely take a look at that.
Yes, Ms. Freeman.
Carrie Freeman, tribal member at large. I guess my question is does your program collaborate with other CDC programs to merge activities that are all related to tobacco cessation, diabetes program, cardiovascular health, those types of things? Because, you know, everybody's busy. And if I'm in the diabetes program and I'm in tobacco cessation and I'm in this, when a lot of times you can merge the activities that are in each of those and it's still beneficial.
Yes, great question, and thank you. Yes, we do. First off, we are participant, our National Center for Chronic Disease Prevention and Health Promotion. As you saw earlier today in the budget presentation, there is a $12+ million initiative called Good Health and Wellness that comes out of the Chronic Disease Center that we participate, and that includes the other divisions within the center. So that gets it, you know, diabetes, heart disease, and cancer, and some of the others that are all within our Chronic Disease Center. In addition to that, you heard us mention that we have the National Network Initiative, and that is a joint initiative that we do with cancer. And so that is jointly funded with both tobacco and cancer funds. So those awardees address both. They address tobacco and broader cancer issues as well. And then just by nature of being within the National Center for Chronic Disease Prevention, we are constantly in collaboration and communication with one another it's looking for opportunities to build on one another's programmatic efforts. Yes.
Any other questions or comments? Okay, Ms. Russell.
Thank you for recognizing me. Thank you. Well, I'm happy to report my nation, and it was really kind of ushered in with COVID, and being that COVID is a respiratory, you know, disease. So it was just kind of like the prime opportunity for our coalition to pass, to have our council pass a smoke-free policy. I'm so happy that it also was extended to our tribal casinos. So really happy that's happening, and we're working with that particular coalition to now tax vaping products. Fortunately, smoking commercial tobacco isn't a really big issue for our nation, but we're seeing the uptake of vaping products for our young members. So my question was around what sort of maybe assistance or technical assistance that you can provide to tribes so that they can connect the systems, maybe IHS or their 6 or 8 facilities and hospitals, to nicotine replacement therapy options when somebody wants to quit smoking. What is there a policy or a model that you could share in that regard? The reason why I bring this up is because I used to do tobacco cessation, and a lot of the times the people came to me when it was really too late for them to cease tobacco use, but they brought their partners.
Yeah.
And we were able to connect them to nicotine replacement therapy with a really great success rate when you have the behavioral modification. And then also the nicotine replacement therapy combined, you know, the chances of quitting are a lot greater. So anything you can share in regards to those two systems coming together, whether it's a program or a policy that can be shared with other tribes?
Yes. One of the things that I think in the previous question, we were asking about the TIPS campaign, and I wasn't really sure if the TIPS campaign addressed vaping directly, but I should have also said that in addition to the TIPS campaign, we've maintained and continue to build on our media communications resource center that we house. And that has hundreds, if not thousands, of communication vehicles that are already developed, that some of them are television ads, radio ads, print ads, and they are some of them address very specific population groups. So we may have some for American Indian. We have some that target African American or rural areas or what have you. Many of them have already been evaluated. And so we can show you the evaluation results so that you can see the effectiveness of the various programs when they were developed. And it serves sort of as a collaborative piece that we are constantly updating it because we're developing new ads. The states and locals are developing new and they submit theirs into the MCRC. So there are literally hundreds, if not thousands, of resources there that folks can come into. And many times, if you can get it for free, if we could give it to you for free, or the state that developed it could let you use it for free, they will. Sometimes there may be a small talent fee associated with it, but that's all you pay. You're not paying this research development and all this other costs. So that's a tremendous resource that's available today, that's been available, that we really encourage people to do, take advantage of. And another resource that we've mentioned is the national networks. You mentioned behavioral health. One of the advances that we've made with the national networks over the years is that for the first time now, one of our national networks is a behavioral health network. And so we are looking forward to them helping us to develop new partners and new resources that will address those issues as well.
Ms. Frias, you have a comment?
Thank you for your presentation. Really do appreciate it, both of you. Your question number 3 about other topics related to commercial tobacco. One of the things that I wanted to bring up is I have been a proponent also about, for commercial free tobacco in our casino. And prior to the pandemic, I had proposed it and wasn't very popular. But pandemic happened and I was like, oh, okay, now we're talking, and so it's people understand it. But one of the reasons, not just for patrons that were going there, but was also for the employees. It was really about, all of the employees that are working there. And, a lot of those employees are our own tribal citizens, and that they're working there sometimes more than 8 hours a day.
Yes.
Full time. And we've seen an increase in asthma. We've seen, we have seen statistics. What is happening? And so we know what happened. We have statistics of secondhand smoke. And we can talk about our ventilation system. We can talk about how great all these things are, but it's not as great as not having smoking indoors, right? And at this point, everywhere else, at least in our area in Arizona, there are no smoking indoors in restaurants and everything else, but our casinos have it. And so now our casinos, we don't have it there, but we, have designated areas. But still, I think about the employees. And I think about the long-term impact of our employees. And, so back to your question is going back and thinking about coordinating with the Institute of Occupational Health and Safety and talking to them, within CDC and having those conversations about how do we go back and think about our employees and the different industries, our casino industries and different types of businesses that our tribes and our nations operate, and how important it is to talk to tribal leaders like myself to really influence and really have that conversation about these long-term effects and what it really does to us. Because a lot of times we don't think about that and we just think about, well, it's revenue and we're doing this and that, but it's not. It really is the health of our community. And we really do need to think about the long-term ramifications of our health and our healing. It's us and it's everybody else who works there. So I just wanted to bring that up and to think about, coordinating with, occupational health and safety and
Yeah.
how that would work. Thank
Thank
you.
you for that. And do you want to add that? Because I want to add too.
Yeah, I was just gonna say, we really love that, two tribes that we worked with in Minnesota, with those same concerns within their employees, actually did clean indoor air quality studies where we worked with their casino to be able to put, the different types of monitoring machines. I don't know all the terminology, but we put it within their casino, within their hotel. And, that information was brought then back to the tribal leaders, to eventually pass commercial tobacco-free policies, because they've seen the importance of protecting their, not only their employees, but also their patrons, in addition to different types of surveys. One thing, I'm just gonna put this out there, I don't know who's gonna fund it. We haven't seen anybody bite on it, but we're like, can we have tribes try going smoke-free or the casinos going smoke-free for a year? And if there is any, revenue loss, that they would be able to be compensated. I know that's kind of a wish out there, but but yeah, that I could send you some paperwork on that, on one of the studies that we did around because one of the tribes let us publish on it, because it just shows the benefits to their tribal members, so.
The other thing that I was going to add to that is, I think your point is very well made. It is a tremendous issue that is affecting the health of employees. It's an employee safety issue, in addition to doing great customer service, a disservice by allowing smoking in an indoor place. What we've learned is sometimes the messenger is as important as the message. And so I could walk in all day long and be seen as the public health guy, the smoking nut or whatever, and it goes in and out the next year, whereas having folks from the gaming industry, there are a group of people in that industry now who have gone smoke-free and seen the benefits in real dollars. It's less wear and tear on your carpet. It's less wear and tear on your curtains. It's less burn marks in the bathrooms in your hotels. It is, there are a number of people who refuse to go to casinos because of the smoke. So in real language that they understand, their colleagues are talking to them saying, hey, we went smoke-free and we're seeing the benefits. And that seems to have more power than the public health guy walking in saying your ventilation system don't do it. So, yes.
Yes, Ms. Russell.
So, I know you have this conference that's coming up, right? I hope you reached out to, I think it's the Black Hills for Center for American Indian Health, right? They were.
He's one of our keynotes,
Okay,
Dr.
very
Dan Henderson,
good.
yep.
So they can tell you their efforts for our nation to go smoke-free, including our casinos. And it wasn't overnight, right? I think it took them almost a decade to do this. And they were sharing with me all the different things that was happening with the casino workers and everything. And, but they got it done. So it can happen. And I'm so grateful that my tribe did that. I'm so happy. But my other question was around, when you talk about tobacco, that also includes smokeless tobacco, right?
Yes.
I think I know more, at least in my community, more chewers than smokers. So it would, and so your campaign materials would also include that, right?
Yes, it does. And again, one of the benefits of just being within the chronic disease center, one of our sister divisions is the division of oral health. And so we partner a lot with them in messaging around smokeless tobacco and oral cancers and all of that. So yes, to answer your question.
Yes, please.
I'm really happy that, thank you for recognizing me, that you're working with that division of oral health, because that's another huge issue for my nation is oral health. There's a lot of oral health policy that we were a part of, and at least in our state, our Medicaid program does not, we don't have a very robust dental benefit for Medicaid in my state of Arizona. And we've been trying to expand that, but it's really difficult. So that's another, in my opinion, a public health emergency is all the oral health disease that we
Yes.
have within our whole population, but especially our kids, and they have the benefit, right? So I'm happy that you're working with them. I think it may be a larger conversation, at least, from my community, we have high early childhood carry rates, and it's just off the chart. Again, if we really were to look at it, we could deem it a public health emergency. But anyway, just thank you for the presentation, how you're all kind of wrapping around it in
Yes.
different ways.
Ms. Stanfield?
Thank you for your presentation. Sharon Stanfield, Rep at Large here on the TAC from the Northwest. And first of all, I want to thank you very much for the handout. It's lovely. And all the good information you provided is right there for us. So thank you very much for that. And I'm going to read my question because it comes from a conversation or information from both Rocky Mountain Tribal Epicenter as well as the Northwest Portland area. So it's real short. And the gist of it is that we need some technical assistance from the CDC for our techs. And according to our understanding, this is about National Tobacco Networks, the TA requests. And apparently, requests are limited to those who can make a request through the CDC's award management platform, AMP. And if, for instance, if the Good Health and Wellness Center in Indian Country grantees don't use AMP website, they won't be able to request technical assistance apparently. And they'll need to go through one of the 7 tribe or tribal organization programs, or perhaps one of the 50 states. So the example they gave me to share with you is for the Northwest Tribal Epicenter, the request for support from Rocky Mountain Tribal Epicenter for the WEAVE program, Good Health and Wellness, would need to be submitted to someone at the Northwest Tribal Comprehensive Cancer Control Project at the Northwest Portland Area Indian Health Board. And then they would have to submit it on this website for the CDC staff to review it, to triage it, to get back with the Rocky Mountain Tech. 2 additional programs involved for requests that could otherwise come directly from Good Health and Wellness straight to Rocky Mountain. So the request is, can the CDC, can your office clarify the process to make sure we're understanding it right? And then the second part of that is there a way to streamline these technical assistance requests? Thank you. Oh, and lastly, under number 1 there, I think having consultation with tribes concerning menthol and flavor related policies would be a great respect to our tribes, especially for those that are still in the process of realizing that commercial tobacco is not healthy, of course, but that would be a great place to start, would be consultation, I think, for number 1. Thank you.
Thank you for your question, and please allow us to go back and investigate and get you a response.
Okay, anyone else? And we need to move on to our next presenters. Okay, I want to take this time to thank you, Dr. Collins, and thank you, Ms. Villaluz, for your presentation. Great information and great conversation at the table. So thank you very much.
Thank you.